All the way back to the fairgrounds, to those train sheds.
Okay, I'd like to call the meeting of the Social Services Committee to order. First on the agenda is number one, approving the previous meeting minutes. Oh, actually, we'll do a roll call first.
All right, sure, Mr. Chairman. Mr. Fine?
Here?
Simpson is excused. Brewski is excused. Cleary?
Here.
Smith?
Here.
Lockhart is excused. Oh, she is excused. McLaughlin?
Here.
Pearlie?
Here.
And Chapman? Here. 6 present, Mr. Chairman.
Thank you.
All right, the first item is approving the previous minutes.
Motion.
Second? Second, Mr. Curley, all in favor?
Aye.
Opposed? Passed unanimous.
All right, item 2 is local law M, which has been tabled pending public hearing. Item 3 is authorizing agreements regarding moving and storage services for eligible temporary assistance recipients. And I believe Ms.
Commissioner Clay's here?
Her deputy's here.
Oh, okay. Yes. Deputy Commissioner Stackwitz, thank you for joining us.
Thank you, Chairman Fine and legislators. I appreciate the opportunity to be here this evening.
So we're on number 3. Yep. Authorizing agreements regarding moving and storage services for eligible temporary assistance recipients.
Yeah, so we're looking to renew agreements with our approved providers, both Don's Moving and Storage and Lidakey. The moving and storage services are for eligible temporary assistance recipients when they have to relocate or need storage their household belongings if they're placed in shelter or in the process of being removed. We're required by law to pay for these moving and storage fees. And we're also required to pay for an allowance for storage and of furniture and personal belongings when necessary. So we're looking to have approval to renew our contracts with the 2 providers that we currently have.
Thank you. Now, are we seeing an increase in use of these services? Are we seeing an increase in evictions due to, we had a moratorium for a long time?
We are starting to see an increase in evictions, so I anticipate that this particular contract for moving and storage will increase as we move forward over the next year, so.
Okay. Ms. McLaughlin?
Is there a time limit on how long you pay? Is it up to 6 months, a year, or whatever?
For the storage, there's not an estimated time frame. We try to get them moved as quickly as we can. The moving piece of it is a one-time fee. So they usually get up to several moves a year, depending on how often. It has to be related to a disaster or some sort of homelessness from an eviction. So they may have, sometimes we have individuals come in a few times to get that service, but there is a limit as to how many times they can get that. So.
Are there any other questions?
Make a motion.
Motion? Mr. Cleary, do we have a second?
Second.
Second, Mr. Pearlie, all in favor?
Aye.
Opposed? Passed unanimous.
All right, item 4 is authorizing agreements with providers of home establishment furnishings.
So, once again, we're looking to renew our current agreements with our providers, our established providers for home establishment services. This is the purchase of furniture, furnishings, equipment, and supplies. So it's like beds, dressers, refrigerators, things like that for individuals. We have a set state schedule that we follow for payment for these services. The authorized rates can't exceed that. This is something that we have 2 providers we contract with, which is City Discount Furniture and Furniture Liquidators. And it also includes a fee for delivery if necessary for the individual to get the household personal belongings delivered to their new home.
Thank you. Is that a motion?
No. Yes. Motion to move it.
Motion, Mr. Cleary, second. Mr. Smith, all in favor?
Aye.
Opposed? That's unanimous.
All right, item 5 is authorizing agreement with Equinox Inc. regarding non-residential domestic violence services.
So we're looking to renew our contract with Equinox, which is our non-residential domestic violence provider. There are 2 services that they currently offer, the core services and non-core services, which is for the Equinox Domestic Violence Hotline. It also provides for individuals to be accompanied to the courts if necessary to provide orders of protection, and also provides linkages to other specialized services and case management services as necessary. So we're looking to renew our contract with them for this.
Do you have any questions from the committee?
Make a motion.
Motion? Second? Second, all in favor?
Aye.
Aye.
Opposed? That's unanimous.
Item 6 is authorizing an agreement with Equinox Inc. regarding residential domestic violence services.
So this piece of it is for the Equinox contract. They're a state-appointed residential domestic violence shelter. They provide 30 beds for us to place individuals who are in a domestic violence situation, both parents and children. So we're looking to renew our contract with them. The contract is for $700,000.
Thank you. And are there any questions from the committee? Motion? Second?
Second.
All in favor?
Aye.
Opposed? That's unanimous.
Item 7 is authorizing the acceptance of grant funding and amending the 2022 Department of Social Services budget.
So this is pursuant to an Office of Children and Family Services federal funds that they received from the American Rescue Plan Act. This is the third of 3 allocations that we were awarded for grants to enhance our adult protective services initiatives to enhance and improve what we do for adult protective cases. We're looking to use this money, which is $125,945, to have access to home care services for individuals who have the need, to also look for doing additional outreach and education to the community about what elder abuse looks like, and also to get some training for our staff on crisis intervention, de-escalation, and mental health training. And we're also looking to collaborate with one of our local mental health providers to work on having an additional mental health component to our interactions with some of the individuals that we're interacting with. So we're looking to have a contract with which is to be identified, a provider, whether it be county mental health or one of the community providers, to provide some mental health assistance when we're engaging with some of these individuals from an adult protective investigation standpoint.
Great. Do we have any questions from the committee? Is there a motion? Second? All in favor?
Aye.
Opposed? That's unanimous. I would like to group. Oh, thank you very much, Deputy Commissioner.
Thank you. Have a good evening.
Do we have a motion to group 8 through 12?
Move.
Second?
Second.
All in favor?
Aye.
Opposed? Okay, motion passes to group 8 through 12. Deputy Commissioner Nicole Ward, we've just grouped 8 through 12.
8 through 12. So these are juvenile justice prevention services. They are Cornell Cooperative Extension, the Berkshire Home Run, LaSalle ERC, Cayuga Functional Family. Did you do that one? Cayuga Functional Family Therapy and Cayuga the MST. These are for youth entering the juvenile justice system, youth that are in Albany County Drug Court, or youth that are at risk of being placed in foster care, or already in foster care to get them out quickly. There are alternative to detention programs. Kind of grouped a couple of different areas together here.
Thank you. I'm curious, how has bail reform laws, has that impacted the amount of youth, or raised the, let's say all of the criminal justice reforms, how has that impacted the amount of youth going into juvenile justice system?
So we need to offer, so because many of the youth cannot now go into the juvenile justice system, we have to offer alternative programs for them. So these prevention programs are helping keep them out of juvenile justice system and further penetrate this system. We have raised the lower age coming up, where now youth between the ages of 7 and 12 can no longer interact with even probation. So we're trying to prepare for that and hopefully use a lot of these prevention programs to eliminate youth having to go into the juvenile justice system.
Thank you. Are there any questions from the committee? Motion? Second? All in favor?
Aye.
Opposed? 8 through 12 pass unanimously. Now, we're motion to group 13 through 15 and 21.
So move.
Do we have a second? Second. All in favor?
Aye.
Opposed? Passes unanimously. We've now grouped 13 through 15 plus 21.
And those are all community and recreational supports.
Okay. So again, a multitude of different supports here. Some are for pregnant and parenting teens. Some of these are clinical services for children who have suffered abuse, neglect, or are in foster care, PINs, juvenile delinquents. I'm trying to look what the other ones are. Let's see. They're serving, community maternity services is going to serve 30 families. Trinity will serve 80 families. Parsons is also serving 75 families. So again, to try to keep youth out of foster care, out of placement, and keep them home and with their community and their family.
Thank you. And are there questions?
Mr. Chairman, could you note my abstention from item 15 specifically?
Yes. And are there any questions?
Motion.
Motion? Second? All in favor? Second. All in favor?
Aye.
Opposed? 13 through 15 and 21 passed unanimously.
Item 16 is authorizing an agreement with the St. Anne Institute regarding the sex abuse prevention program.
So this program is for families who are experiencing issues related to sexual abuse of one or more of their children who are also at risk of being placed in foster care.
Thank you. And are there any questions from the committee?
Just curious, what is the criteria for someone at risk? How do you know ahead of time who to serve?
So these are children that have been sexually abused, so
Okay, so it's not,
it's not,
it's
so
not
we're trying to
prevention?
prevent them from.
okay.
Yeah.
Yeah.
Are there any other questions? I do a motion. Second? All in favor?
Aye.
Opposed? That's unanimous.
Item 17 is authorizing an agreement with St. Anne Institute regarding the juvenile sex offender program.
So this is for families with youth, the ages 10 to 18, who have engaged in sexually inappropriate, aggressive, or abusive behavior. And it's a clinical, specialized program to help them with these issues in their family.
Thank you. And are there any questions from the committee? Motion. Second? All in favor?
Aye.
Opposed? That's unanimous.
Item 18 is authorizing an agreement with Berkshire Farm Center and Services for Youth regarding the Focus on the Future program.
So this is an independent living skills program with the goal to aim to reduce the dropping out and preparing youth to enter adulthood. They include intake, assessment, crisis intervention, linking the youth to community services, and getting them ready for educational and workforce development.
Thank you. Are there any questions? Motion? Second? Second. In favor?
Aye.
Aye. Opposed? Passed unanimous.
Item 19 is authorizing an agreement with St. Catherine Center for Children regarding foster care specialty prevention services for the Parent Care Program.
This program is for parents with significantly developmentally disabilities or psychiatric disorders, so to providing support so that they can keep their children with them in the home.
Thank you. Are there any questions from the committee? Motion? Second? All in favor?
Aye.
Opposed? Passed unanimous.
Item 20 is authorizing an agreement with Community Maternity Services regarding foster care specialty prevention services.
So this is also for parents who have been diagnosed with developmental disabilities and/or significant mental health disorders. Preference will be given to families who have a child between the ages of 0 and 5 to again prevent them from going into the juvenile justice system, to help with PINs, abuse, neglect, and foster care.
Thank you. Are there any questions from the committee? Motion? Second? Second. Favor?
Aye.
Opposed? Passed unanimous.
21 was previously approved. Item 22 is authorizing an agreement with St. Catherine Center for Children regarding the Connections Program.
So this is a trauma-focused cognitive behavioral therapy program for children from the ages of 4 to 13, which takes place in Burn Knox, Westerlo Elementary and Middle Schools. And again, for youth that are at risk of placement, to keep them out.
Thank you. Do we have any questions from the committee?
Make a motion.
Motion? Second? Favor?
Aye.
Opposed? Passed unanimous.
Item 23 is authorizing an agreement with the Children's Health Home of Upstate New York regarding reimbursement of Medicaid care management services provided to children in Albany County.
So this is 100% state funding for the department to be able to claim reimbursement for all Medicaid care management services with children with qualifying conditions.
Thank you. And are there any questions? Motion? Second? All in favor?
Aye.
Aye.
Opposed? Passed unanimous.
Item 24 is authorizing agreements with various agencies regarding the facilitation of services associated with the Family First Prevention Services Act.
So if a child is placed in a QRTP, a quality residential treatment program, we have to do, have an assessment done, and it has to be done by QI, a qualified individual. Currently, we're doing all of that in-house through our children's mental health unit, but we're finding that we're getting more and more cases, so we just want to have this renewed on the record so that if we do need to contract with an outside agency, we have the ability to do so.
Yes. Thank you. Are there any questions? Motion?
I actually have a question.
Okay.
Just because this one says various agencies. Not really the children or the juveniles, but are the agencies like checked up on to make sure that they're actually turning out a good product or anything like that?
The
Well, it
quality
kinda has to do with-
individual one?
It kind of has to do with them all, like, I mean, is any, like Trinity Alliance or all these various agencies, do they get like a report card to see what if their programs are
actually-
working?
For the QI one,
No, it kind of goes back to all the money that we're approving.
for the prevention?
Yeah, yeah. I mean, is there like a-
Actually, only 33.5% of all those is county funded. Most of it comes from federal and state funding. But we do, we
and it's
do.
working?
Yeah, we
Okay.
do. We have a whole prevention unit that goes in. We know that, that in 2021, we had 423 referrals into prevention services. We know that we had 398 parents
Okay, so
attend
it's
the
working. That's
classes.
all. I was just wondering if, it seems like program after program, I just want to make sure they were working.
Yeah, and these ones are full. I mean,
Perfect.
we're trying to move families in and out as quickly as we possibly can because there's such a need for them.
Perfect, okay. I'll make the motion or second it, whatever.
Second.
We have it. Okay, all in favor?
Aye.
Opposed?
25, authorizing agreements with foster care providers.
So this is a long list of different foster care providers, and they're New York State approved providers. And this will just give the department, when kids come into care, the ability to partner with any of these. And we don't pay any more than the maximum state aid for these foster care providers.
Great, thank you. Are there any questions from the committee?
I assume those don't include individual licensed foster parents, but they're all agencies?
These ones are all agencies, yeah. But the agencies can partner with individuals.
Understood.
Some of them are county departments of social services as well. So we partner with other county.
Throughout the state, all over Rochester.
Yeah, there's other departments of social services that so for instance, locally, we might need to partner with Schenectady if they have a foster home. So we need to have partnerships with the different social service agencies.
And do they do that with us? Do they? Okay.
And do we feel confident, I mean, obviously, within last year, there was a very significant tragedy that involved partnering with another county agency, Schenectady in particular. Do we feel confident that the other counties are up to our standards relative to foster care training and the various things that we've
I mean, they have to go
adhered
through the
here?
same standards that we do. You know, we're all monitored by OCFS, our oversight agency, so I would hope that they are. Unfortunately, tragedies do happen. You know, but if we're checking all the boxes and We should have people going into these homes and making sure that everything that needs to be done is done. So just because another county might take in one of our children into foster care, that doesn't, we still have to go and do visits. It's just we're using one of their homes that they certified.
Motion.
All in favor?
Aye.
Opposed? That's unanimous. Okay, that's it.
Chairman?
Yes.
I'm here to discuss local law M, and I did, I
That
read-
that item was tabled pending public hearing, so it's not actually on.
Well, let me ask you something then, because the.
We don't typically allow speaking on it.
This committee went ahead and sent it out to public hearing, 2 other committees tabled it.
Mhm.
So we've gone ahead and we've amended this legislation.
Mhm.
So shouldn't we be discussing this at this committee?
Well, it's already been passed out, so it's not properly before this committee. I mean, if you'd like to be sent back by the chairman at the meeting, we certainly could do that for the purposes of its review.
What's the proper procedure for this then? What,
So it's already been legally passed out of this committee. It's no longer before this committee. Only the local law itself is. The public hearing has been passed out. So, I mean, we could have the chairman, and feel free to jump in, but we could have the chairman send the public hearing back to social services to reconsider the updated.
what about,
I understand the
what about the
amended.
amendments to the legislation? I mean, shouldn't they be discussed?
Well, I would think they should be, yes. Unfortunately, it's not before this committee at this point in time.
So how do we get it back before this committee again?
You could have the chairman send it back, or obviously ask the chairman to have it sent back for
In
consideration.
the amended form?
In the amended form. As you know, we received the amended form late Friday, so.
Yes.
Obviously, it's not something that could have been put on, for this agenda had already gone out.
So therefore, the procedure then is for me to ask the chairman at our full meeting of the legislature to send it back to committee in the amended form?
Yes,
That is the proper procedure?
that's my understanding, yes.
You understand? Okay, I think I'm being stonewalled here.
Okay, I can
But I
discuss
don't
with
have-
minority council certainly further.
Yeah, unfortunately, he had oral surgery today and is not
Okay.
able to be here, so I don't have counsel present to advise me, so.
And we can discuss further before the, I mean, it's just that there's nothing literally before us. That's
Okay.
the problem.
All right,
What's the
then.
topic of this local law?
Local law M is
Remind
the
me.
Republicans' gun safety,
So
or
gun safety?
Okay.
gun law, it's now expansive.
I do have copies. We did email this out to everyone, but we do have copies to hand out.
Although you may want to email it out to everyone legislature-wide, because I know it didn't go to at least one person. But you can,
Yeah. Do we have a motion to adjourn?
Thank you.
Second?
Just want to make sure Mr. Morial is satisfied.
Well, I guess I have no choice at this point. We will, I'll have our council contact.
Yeah, I'm happy to talk to Ernest.
And we'll work this out and see what we can do. But obviously, I also have a press release that our district attorney sent out today. I don't know if anybody wants a copy, but after the meeting, I can hand this out to everybody, so I'll take a copy.
sure, after the meeting, anyone can discuss whatever they'd like.
Okay, thank you.
Second.
Second, okay. All in
Thank
favor?
you.
Aye.
Opposed? Meeting is adjourned.
Thanks.